Okay, I think we can start now. And let me welcome you to the South-South Learning Network second champions meeting. As you can see on the screen, while we wait for the others to join, let's introduce ourselves in the chat box. And then if we have questions during the session, we can put them in the chat box. We hope we will have time to have discussions as we go along. For today's meeting, we have 3 objectives. The first is to provide an environment where country champions can share the South-South Learning Network's learning objectives and progress made in the various countries. We're going to hear that through presentations, through discussions. The second will be to review successes and challenges, including recommendations that will be shared by country champions during that was shared during this survey interviews. And then the third will be to share upcoming resources and opportunities available for countries and programs across the globe following our efforts in the South-South Learning Network interventions. I'm going to start by introducing the chair for the first session, where we'll have opening and welcome. And I'll start by introducing Henry Ndondu, who is senior technical specialist for key populations working with the National AIDS Council in Zimbabwe. Henry will chair this opening session. So Henry, over to you. And we are listening to you take us through this session. So let's welcome Henry, please. Thank you.
Thank you, Dr. Kalada. Just a correction there. So my name is Humphrey Ndondo instead of Henry, Humphrey Ndondo. So thank you so much, Dr. Kalada Green. So good afternoon, colleagues. It is my honor and privilege to chair this opening session of the second country champions meeting for the South-to-South Learning Network. I am today bestowed this privilege by the Zimbabwe country champions, and more specifically by our principals, Dr. Bernard Mazima, who is the Chief Executive Officer of the Zimbabwe National AIDS Council, and Dr. Owen Magurungi, who is the Director of the AIDS and TB Unit with the Ministry of Health and Childcare here in Zimbabwe. My task is very light. Allow me to introduce our esteemed speakers for this opening session to give us their words this afternoon. Our first speaker is NFPA Global Coordinator on HIV/AIDS and Senior Technical Advisor. She serves as a co-chair of the Global Prevention Working Group, which is an advisory body to the Global HIV Prevention Coalition. She has 25 years in both prevention and sexual and reproductive health and rights. With Dr. Mike Ekisa, who is the head of the County AIDS and STI Coordinator in Kenya. Dr. Ekisa has been on the Kenya South-to-South Learning Network country champion since its inception. Without much further ado,
Elizabeth, over to you.
Will you allow me to take the floor? Elizabeth, over to you.
Thank you, Humphrey. It's my pleasure to welcome all of you to the second champions meeting for the South-South Learning Network. No doubt, we are all eager to hear more on HIV prevention successes and even more eager to come together to exchange and illuminate needs and formulate solutions to challenges faced in countries and communities seizing the opportunity to glean knowledge gained by others, and adapting to meet each specific context to accelerate prevention towards reaching national targets. This forum, as we know, is about learning. And while learning should be lifelong, here it can be potential building and life-saving. Ben Franklin, an American founding father, once said, "Tell me and I forget, and teach me and I may remember, involve me and I learn." You're proving that this platform is a key tool for that engagement to learn. And as I stated at our last meeting, we must continue to nurture this learning culture, continue to apply and share the learning when we leave this meeting, and bring new reflections, evaluations, successes, and failures when we return to this forum. It is that perseverance, that trust, this safe platform, and these relationships built in the South-South Learning Network that harness the power of change and empower everyone here with the knowledge to drive that change. It's heartening to know that you want to expand the issues addressed in the forum and to extend this learning and sharing opportunity to other country champions on the continent and to learn from other regions as we move towards our goals of 2025 and 2030. And your work here will be so important as we move into the HIV Prevention 2025 roadmap to reach those left behind with the right information, the right services, in the right place at the right time, and in a respectful environment. So again, welcome to everyone, and I'm looking very much forward to learning from you today.
Thank you, Elizabeth, for those remarks. We will hear from our second speaker, Mike Ekisa. Dr. Mike, over to you.
Thank you very much, Humphrey. It's my hope that you can both hear and see me, Humphrey.
Yes, we can hear and see you. Please proceed.
Thank you very much, and good morning and good afternoon, colleagues from across the world. As introduced, I'm Dr. Mike Ekisa from the Kenya Champions team, and we are more than honored and privileged to be part of this South-to-South Learning Network. As we are aware, as a world, we are in different stages of really achieving HIV control. Today, I was looking at an article with a colleague and just seeing that the concerns of Europe, for example, I think what is trending could be to do with the involvement of the PWID communities. The concerns of Africa fairly vary from country to country, but a common stand remains. We remain far from achieving our global HIV prevention targets. Africa, unfortunately or not, still bears the burden of HIV disease, both infection and the bad outcomes. And all these bad outcomes, especially we look at our outcomes data through retention, and we see that about 2 out of 10 of newly diagnosed HIV patients in Africa, on average, get lost, most probably to mortality. And the best way of closing this tab, despite the current and advanced treatment interventions, is prevention. And our prevention has to be based on the agreed-on principles, 6 of stakeholder engagement, respect to human rights, meaningful involvement of civil society. And I'm glad when we're reviewing the Kenya context of sustainability recently, we learned that our biggest strength as a country program was in our engagement and involvement of our civil society. And probably these are some of the things that SSLN will provide us a chance to share with our brothers and sisters in this network. Still part of this principle, this use of evidence, so that we can have up-to-date programming based on available evidence and knowledge, comprehensive responses that integrate prevention, treatment, care, and support, and the principles of non-discrimination. Dear colleagues, these are proven principles, which if our programming will be based on them, probably we can fast track our arrival to the global prevention targets. And really, when you're there, this is where SSLN will sit. And so as a country, we cannot but appreciate in a better way the Global Prevention Coalition, together with the direct partners who have been party to delivering the SSLN network. And here we get a chance to learn from each other and just see how to make this better. And today, as we assemble for our second experience, we look forward to advancing that goal of sharing our experiences so that we can stand on each other's shoulders and become bigger giants, and perhaps not repeat mistakes that a brother or a sister has had to do to achieve a milestone. So thank you for being here, and we look forward to a fruitful 2 hours. We can only be more than attentive. I appreciate my Kenyan colleagues on board, and I recognize and appreciate each of the champions from the 10 countries. And you know what? We owe it to our next generation to have an HIV/AIDS-free generation. And this here is just a golden opportunity for this.
Thank you so much,
Thank you
Dr.
very
Ekisa,
much.
for the remarks. We will move to the second speaker. Thank you so much. Thank you so much, Dr. Ekisa.
Thank you.
Thank you so much. With that, we are going to move to the second session of our program, and allow me to invite our speaker for this segment. Our speaker is Parinita Bhattacharjee. Parinita is the leader of the KP pillar of the South to South Learning Network and is engaged with several countries through the HIV prevention self-assessment tool and the technical assistance process. She has been involved in South to South Learning Network since the design stage. Parinita, over to you for your update.
Thank you so much, Humphrey, and full marks for pronouncing my second name correctly. Welcome, everybody, and my responsibility today is to give a progress report on the South to South Learning Network. For those who are new to South Learning Network, and for those who have been here since inception, I see quite a few of you. I thought it would be interesting to look through this timeline and see how far we have come. The Global Prevention Coalition introduced the South to South Learning Network to the NAC directors in May 2019 during their meeting. After that, a steering committee for the network was formed, and we started initiating country meetings and discussions. We facilitated the countries to conduct PSATs. Quite a lot of you may be aware of the PSATs. It was in the later part of 2020. And the PSATs results helped us develop a learning agenda, and learning sessions were initiated in January 2021. And for the last 10 months, we have been engaged in finalizing the agenda and implementing the same. We are moving towards the end of this learning grant, and starting from this meeting onwards, we are initiating a reflection process that will guide the development of the phase 2 of the South to South Learning Network. Next slide, please. So at this point of time, I would request you to think of one word that comes to your mind when you think of the South to South Learning Network, and write that word down using the link in the chat box. If you could click on the link which is shared in the chat box, you would be directed. There is also another link on menti.com that has been provided. You have to enter the code word, which is there on the slide. And it will take you to the site and you can write that word. And Yanni, I'm hoping that as people are writing that word, you are going to show us the Mentimeter, so we know what's getting written there. Okay, so I'm hoping that people have gone to the link and are writing their word. And if technology is not allowing us to show what people are writing, then let's just move to the next slide. Will that be okay? Okay, and if people haven't gone to the link, please go and keep writing as we continue our presentation. So I'm sure as champions, you are aware of this process, which was the PSAT process, what we call as a program's self-assessment tool. And many of you have been engaged in conducting, facilitating, participating in this exercise for KP pillar and the condom pillar. Some of you have also completed the PSAT for all the 5 subpopulations for key populations. The summary results were made available to you. It's available in a portal. And these PSAT results inform the development of the learning agenda and the technical plan. Just wanted to reflect on that a little bit. Next slide, please. So we used the cross-country analysis. We looked at all the countries that have completed the PSATs, and then we tried to use the analysis to match countries for learning. Like in areas where more than 5 countries identified gaps or weakness, we defined those areas as areas for webinars, and we scheduled and conceptualized that, and you have already attended 1 or 2 webinars in that area. In areas where results were polarized between 3 to 5 countries, we decided to have link and learn sessions, and that's where they were conceptualized with the host country identified based on their strengths to lead that link and learn sessions. Where key gaps existed for each country, guidance was provided to identify the TA required, and we developed TORs and provided TA. I'm going to go in a little bit detail on each of those activities as we move forward. Next slide, please. So we use a number of channels to ensure that the countries can share their experiences, learn from each other, and network. Some of the channels that you have participated in are webinars, virtual study tour. It is new, and we're going to talk about it a little bit more later. Inter-country link and learn sessions, many of you have led, many of you have participated. Case study documentations, and the South-to-South data repository. We have also recently started inter-country TA sessions, and the first one was between Uganda and Kenya. In many countries, we have provided grants to buy small equipments or to conduct face-to-face meetings to facilitate participation in these activities. Next slide, please. Talking a little bit about the webinars, we have hosted 5 very successful webinars to date. 2 on the condom pillar, 1 was on back to basics, where the presenters shared tools and guidance to design, fund, and implement an effective and efficient national condom program. And the other one was on innovative approaches to monitoring condom programs. The 3 webinars on the key population pillar included the launch of the KP community of practice and 2 sessions on building strong foundation for scaling up impactful programs with key populations. In each of our webinars, we normally have a presentation by providing global guidance, then a national program makes a presentation, and then we hear experiences and feedback from the community presenters. So we plan to conduct such webinars every quarter in collaboration with GPC, and all those who have missed 1 or more webinar can find the recordings in our repository. Next slide, please. We also co-hosted a 4-day virtual workshop on differentiated service delivery for key populations in partnership with Sequin Network. And you can see the pictures over there. Many of you have participated in this event. 12 of our country champions participated in the workshop, and several others also facilitated sessions. South-to-South Network helped the national programs to showcase their work. This process also increased interest among countries to learn from other countries. As an example, Uganda Ministry of Health approached NASCOP at Kenya seeking TA for scaling up the MAT program in Uganda. And we have recently initiated a 5-session virtual TA from Kenya to Uganda. Next slide, please. In the original proposal, the plan was for countries to visit other countries to see good practices and interact with implementers to understand the best practice. However, COVID-19 related travel restrictions kind of spoiled those plans a little bit, and we had to move towards a virtual tour. We are supporting countries to film their best practices, and using these short films, we would be facilitating interactions and learnings between countries. At this point of time, we are working with South Africa to document their work on safe spaces, and you'll see a glimpse today. And we are working with Kenya to showcase the interventions with young key populations. And of course, Malawi is in line, next in line. And we also hope to initiate the face-to-face visits very soon. Next slide, please. Our Link and Learn sessions actually have been quite a hit. The sessions are different from webinars because we invite a few countries to participate, maybe around 3 to 4 countries. One country leads and the other country participates. So we have had several Link and Learn sessions. We have had 3 Condom Link and Learn sessions and 5 KP Link and Learn sessions. And these Link and Learn sessions, as I said, countries lead and they kind of design it and make presentations and lead the Q&A sessions. We have a lot of time for Q&A during these Link and Learn sessions because we want to make these sessions focus on problem solving, including learning. Next slide, please. Along with the learning sessions, we have also provided TA to countries based on their need, and it's also guided by the PSAT analysis. For example, we have provided TA to Uganda to finalize their key and priority population programmatic framework. We have supported Kenya to cost their KP interventions. Also, we are in the process of supporting Ghana to develop a SOP for intervening with young key populations. Next slide, please. So all the country documents and global resources are uploaded currently in a repository that the countries can access. The plan is, of course, not to create a parallel system, but to integrate the repository within the new GPC website, which is under construction at this point of time. So how have the countries applied these learnings? The countries have used these learnings, as far as we know, and the evidence that we have is to shape policies. Some of the countries have used the learnings to inform the national funding application for Global Fund. Some of them have applied to in their NSP, especially in the catch-up plans. One example comes in mind is from South Africa. They've also used this to inform targeted requests for technical assistance. And we have also been requested by TSM to provide some of the support and use these learnings for new HIV prevention strategies that are getting developed in Malawi and Mozambique. This is a very nice quote from Tanzania. I will not read it, but I'm sure you're able to read it and appreciate. Moving to next steps. This is my last slide, Humphrey. We will continue to travel along our journey and implement the agenda that we have for the South-to-South Learning Network. But in addition to that, we are looking at a possible expansion to cover more technical areas, more prevention pillars, as we are focusing now on partly KP and condoms. We are also looking at including more countries, including Francophone countries in Africa and in Sub-Saharan Africa. We are also looking at adding a face-to-face component comprising workshop and mentoring visits, deeper engagement with countries to apply learnings into action. As the South-to-South Learning Network country champions, you have been very, very instrumental in shaping the South-to-South Learning Network during the first phase. Your feedback provided insight into aligning the network to be further responsive to country network needs. At this juncture, we would like to request you to click the link again that you will see in your chat box and let us know what would be most valuable to your country in the next phase of South-to-South Learning Network. Mohammed has put up the Menti link again. So please go into the link and write what would be most valuable to your country in the next phase of South-to-South Learning Networks. As the next phase is getting designed, some of your feedback would be very, very useful. So at this juncture, I would say thank you for listening and hand it over to Humphrey. Over to you. Humphrey, are you online?
Hi, Pari. Sorry, I think I got cut off there for a second. My apologies. Shall we take one or two questions for Pari, and then we will hand over immediately back to the chair.
I see a hand, Humphrey.
If there are any questions,
I see that Segun has raised.
Pari.
Segun has raised his hand. Would you like to unmute yourself, Segun, or right?
Hello, do I go ahead? Okay, thanks very much for your presentation. How soon are we looking at this regional physical meeting? How soon is it likely to hold? Over.
We are very, very hopeful. We are hoping that possibly in the new year, we should be able to start at least in our local region, like East Africa or Southern Africa, to start with. But we are very hopeful that in the second phase, which starts in March, we should be able to use that as one of the strategies for sharing learning. But maybe one or two pilots may happen in the new year, January, February. So Humphrey, I don't see any hands raised, or I don't see any questions in the chat box. So possibly we could conclude the session here. Thank you so much, Humphrey.
So thanks, Pari. I've been cut off, but without much as presenters and hand over the chair.
Thanks, Humphrey, and my sincere apologies for calling you Henry. I was looking at the name Humphrey, and then my mouth was saying Henry. But Humphrey, thanks a lot for excellently chairing this first session. And we'll move straight to the next session, and I'll invite Dr. Margaret Kagashi, who is the head of the prevention unit in the National AIDS Control Program in Tanzania. Dr. Margaret, over to you. Thank you.
Thank you so much, Kalada. Good morning, good afternoon for those who are in different seasons. It has been good to be in SSLN for the past few months, and we have learned a lot. So my small work is just to introduce our next topic for the next 20 minutes, we'll be looking at the success and challenges shared during the key and informative interviews. We know this, we have gone through this a few months ago. And let me introduce our next speaker, who is Lulama Lunik. Lulama Lunik is an associate of the SSLN team. She conducted the feedback interviews and the analysis that she will be presenting today. I know a few of us, we have met her during the interview. So she meditates at least 6 times a week. I'm an avid meditator, if that wasn't ever such a thing. So let me welcome Lulama for the next section. Then we'll be having a Q&A session. Lulama, over to you.
Thanks, Dr. Kagashi, and nice to see you again. Good afternoon, colleagues. As Dr. Kagashi has said, my name is Lulama Lunika, and I'm an associate part of the SASA Learning Network team. And today I have been given the privilege to share findings from the country feedback survey we conducted earlier this year, where we aimed to gather insights from countries about their experiences, about being part of the SASA Learning Network, and also get some feedback on how the SSLN could improve the experience for countries. So as an overview, I will start by just providing a background on this process and what prompted us to initiate it. And then I will reflect on what were our objectives and our aims, and what methods did we apply to collect this feedback. Then I will share what we found from the countries, and then also finally share what the key takeaway messages were and the key insights that countries shared. Next slide, please. So as a background, as Perry has kindly presented, there have been a lot of activity throughout the duration of the SASA Learning Network so far. And seeing that there's been so much activity since the inception of the program, it was important for the SSLN to sort of pause and reflect on the program to ensure that sufficient fulfillment of the objectives of the program, and also to adapt and to continue to steer the program into its intended direction. Therefore, we sort of set out to conduct these interviews and these surveys, and to also reflect to ask countries to basically reflect on their participation and to strengthen future implementation of the learning network. Next slide, please. So essentially the experiences and feedback from countries will inform how we adapt the program and how we optimize the program going forward. Therefore, the results from these key informant interviews that we held will be used to determine the extent to which learning outcomes have been achieved within the countries, to gather information that will allow us to remain flexible and also responsive to the way in which we are implementing the learning network. We'd also want to use these results to determine how the learning network can be advanced, to optimize learning, to make changes at scale. And finally, we really want to address any challenges that were raised within the interviews or that were identified, to build on the successes that were also identified, and to also implement any recommendations that the countries raised to improve the design and how the learning network is implemented in the future. Next slide, please. And so I'm going to now reflect on kind of the methods and kind of the process that we followed to conduct and assess the feedback. So as you can see, this is our roadmap of our process. We followed a 6-step process where we first designed this questionnaire, which was structured and allowed us to collect really rich and informative qualitative data. We then purposefully sampled country champions who had an in-depth knowledge and experience within the SASA Learning Network. We then conducted the interviews, which were about an hour and a half long over a 4-week period. And then we transcribed and translated the interviews for analysis. We then analyzed the results and identified themes and codes that emerged from the data. And then finally, we drafted a findings report, a full report, which I will share with you, all after this meeting. Today is basically the summary or the key kind of findings from that report. In total, this whole process took about 3 months. As Dr. Kakashi said, it took a while to find time with colleagues, as I know you're all very busy. But once we're able to meet, we got some rich insights. A total of 8 countries were able to participate in the survey, and 15 country champions were interviewed. And I've listed all of the participating countries there at the bottom of the slide. Next slide, please. When we analyzed the results from the interviews, these were the key themes that emerged, which led to the development of the code book that you see on the screen. I will then use this code book as a framework to discuss the results in more detail. So starting with the first kind of theme, next slide, please. Country champions first reflected on their engagement and involvement in the SASA Learning Network. And in terms of this theme, in most countries, came apparent that there has been actually consistent participation in SASA Learning Network activities. And the highlights of these activities were the PSATs and also the webinars and the Link and Learn sessions. Next slide, please. In terms of the PSATs, all countries reflected on how useful they were, as particularly in better understanding their country programs and in having good oversight of their progress. Although they were very time-consuming and rigorous, countries felt that the benefits of doing the PSATs really outweighed the time cost of completing it. And as I go through the feedback, you'll see that there are quotes on the slides where you see the country reflections in more detail. But I won't go through the quotes, I'll just highlight some of the key findings. And then in terms of the webinars, sorry, Yani. In terms of the webinars and the Link and Learns, definitely the webinars stood out more to countries. They were the highlight. And that countries, although they appreciated the Link and Learn sessions and learning from other countries, they highlighted that it would be great to also hear about challenges that countries experience and not just their successes. And just generally, countries were not as familiar with Link and Learn sessions as they were with the webinars. Next slide, please. Another theme that we looked into was whether the SASA Learning Network was relevant to countries. Slide. Essentially, whether the topics and the activities and everything that the SASA Learning Network was covering, we wanted to assess whether that was relevant to countries. And it came out that there is definitely increased awareness of in-country and peer programs, as the SASA Learning Network activities, have provided an opportunity for countries to have a better overview. So they have this full perspective, full view of the country program and their progress, as well as those of their peer countries. So that really came out strongly. And a sub-theme in this is that they were able to identify gaps in their own country programs. So a huge sort of benefit of the PSATs and of learning from other countries, of attending the webinars, etc., they're able to really clearly see where the gaps are in their own country programs. And by identifying these gaps, they were able to set priorities and better manage their programs going forward. However, countries highlighted that, to further ensure that the learning activities are relevant, they would like to see, more of the learnings actioned, and they would like some help getting the learnings applied after the learning events occur. So there's this after event, after the webinar, after the link and learn, what next? And so countries highlighted that very strongly. And then another theme that came out is that there was clear appreciation for the exposure to peer country programs, but also to global best practice. So this platform of the SALSA Learning Network has really put to the forefront, what other countries are doing, how they responded to their own epidemics, and also, has helped relate with other countries as well. So that learning about what other countries are doing has helped the relationship aspect and building relationship across countries. Next slide, please. Our second last theme is around coherence to national and or HIV initiatives. So we asked countries, to what extent does the SALSA Learning Network activities align with your country, program, with your HIV initiatives and any national milestones. Next slide, please. And countries said that there was alignment in terms of global standards. They were able to align their programs based on global standards, and that SSLN, provided this global benchmark where they can then sort of contrast and compare their progress against. In particular, countries reflected that, they learned through this whole process that their national M&E systems and their data systems need further alignment to global standards, in particular disaggregating age, gender, and KP subgroup. Excuse me. Similarly, countries reflected that they were able to strengthen their national condom their national KP and condom strategies, guidelines, and program design overall. And the next sub-theme was around leveraging SSLN resources and partnerships. So countries felt that through this, the SALSA Learning Network provided additional resources and additional partnerships that could have been made. One example here is the quote at the bottom is from, I think, Zimbabwe. I can't see the full quote on my screen, but it reflects a colleague who then reached out to UNAIDS for further support based on their identification of gaps. And the SSLN platform, made that connection possible. Next slide, please. And then lastly, in terms of practicality of implementation, there were about 5 subcategories or sub-themes in that overall theme. Next slide, please. It became very apparent to the countries that virtuality was a challenge, and that there was a call for more face-to-face engagement, or engagement that wasn't so heavy reliant on this virtuality platform. Countries reflected that access to data and poor internet was really a challenge. The next sub-theme was around ownership. Countries felt that the way that the SALSA Learning Network was designed and conducted allowed for greater ownership as the country, which they really appreciated, and that the self-assessments, particularly the PSATs, were a way to really own kind of the country program itself, whether they were identifying gaps or whether they were identifying strengths, but they were able to fully own that whole process of identifying what they need to do to improve their program. Slide, please. And then countries also reflected that the SALSA Learning Network is a safe space and has really promoted a great culture for learning. In terms of timing, again, as I reflected earlier, the countries, do have a lot of competing priorities, and sometimes they find it a challenge to engage in some of the activities within the SASA Learning Network. And then lastly, in terms of facilitation, they feel that, the flexibility of the SASA Learning team has helped them build trust and understanding, and that having a focal SSLN person for each country has really helped them better engage within the platform overall. Last slide, please. So what to take away from all of this process? If I had to summarize everything that the countries have said, I would summarize it in five points. And the first point is that countries did sort of highlight that they would like to do more of the PSATs, right? They found real value in the PSATs, but they would like to expand it to the other pillars and to other vulnerable groups. In particular, the AGYW pillar came out, PWID and transgender and prisoners also came out. And you will see that some countries have already started to initiate this process. For example, Kenya and Nigeria have completed all of the PSATs for the KP pillar. So they've done the MSM and FSW, but also the PWID, transgender and prisoner PSATs. And then also Kenya has just also completed the AGYW PSAT, which is great. The second point that countries reflected on was that they would like to expand peer-to-peer interaction. And this is around increasing more face-to-face interaction. Slide, please. And then countries reflected that in order to maximize sort of the PSAT itself, it would be best to align the completion of the PSAT with other key milestones within the country. So that is, when the country is probably reworking the NSP or working on the Global Fund application, it would be great to align the PSAT to that timeline for the greatest value. Second, lastly, is that countries would like to convert learning into action. So taking the learning and then implementing it, there's a bit of a gap towards, from that step to the next step. So they would like more assistance on that. And lastly, they'd like to bring learning more to a subnational level or to a subnational platform. And that's the last slide for this presentation. I will pause here. Thank you, everyone. Next slide, please. I'd like to thank all the country champions who participated in this interview process. Next slide, Yanni. And these are all the country champions that participated. Mozambique is not on the slide, but Mozambique country champions, I thank you as well.
Thank you. Thank you, Lulama. Now, as we meditate on what Lulama has been presented now, I know we have gone through this process, some of us, and the teams were very cooperative when you have seen the results, the findings which has been presented, the relevance of the SSLN activity. They were exploring the sustainability of what we have been learned during those processes, engagement, involvement, consistency, coherence, all that's been presented. We have just 3 minutes before we wind up this session. Probably if you have any question, and we see your hand, you have any comments along what has been presented, you're welcome. I'm not seeing any hand raised. If you have any, probably when we close the session, you can put it on the chat box. So Lama can address that. Let's wind up the session. Thank you, Lama, for the presentation. We're having 20 minutes and now it's over. Over to you, Kalada. Oh, sorry, we have a hand up. Yes, you can unmute, James.
Yes, I just wanted the presenter to go back to the last slide.
Okay, Lulama, yes, here.
Okay, the last point I didn't understand it properly, the mainstream and expand learning.
Sure, I'm happy to clarify that. So it came out strongly that countries would like the learning that's taking place in these platforms, for example, to a more subnational level. So basically, whether it's engaging districts, provinces, counties, basically take the Learning Network initiative to that level, to a more localized level.
Hope James, okay with that?
Thank you.
Okay. So I haven't seen another, I think that is the previous hand. Okay. So over to you, Kalada. I think we wind up this session at this point. Thank you so much for the cooperation you have shown us. Over to you, Chair.
Thank you, Margaret. And I'm looking at your picture at Lama's last slide. It's good to put a face to the name. Thanks for chairing this session. I'm going to invite Dr. Daniel Bayamkama, who is the head of prevention, Uganda AIDS Commission, to chair the next session. Dr. Daniel. Dr. Daniel.
Thank you, Chair. Now I am meant to understand that we are supposed to have broken into sessions, and the breakout sessions, somebody should have facilitated that, should have guided us.
Yes. We're moving into breakout rooms, and then when they come, you will take charge. So we'll be good.
So I think in that order, we shall request the three moderators from the various breakout sessions and to give us feedback. To give us feedback, starting with Thomas from breakaway room 1, if you're ready. And if you're not ready, I can ask whoever is ready of the three to go first. James Takura and James.
Ziko Mwambili. I can start.
Okay.
So in our group, we are requested to look at the recommendations from the assessment and then determine whether they are reasonable, feasible, or achievable, time-bound, and then prioritize them. So we had a thorough discussion on the recommendations. The first one was to expand the prevention focus. Second one was expand peer-to-peer interaction, align timing of the PSAT to key milestone, and convert learning to action. We had our rapporteur in the group. Maybe she can come in to present what we have agreed. Thank you. Hello.
So you could name your rapporteur?
Yes.
Yes.
Okay, so I'm going to report in order of priority that the group had so priority was expanding the PSAT beyond current pillars, and the group agreed that this is both feasible and achievable, but that should be done in conjunction with the country teams, in consultation with country teams. And there was also a suggestion to focus on the epi profile of the country, and based on this, consider going subnational. I think the team also agreed that we need to expand the PSAT beyond the current prevention pillars, but also to other key populations groups like transgender women, or people in prisons, or people who use drugs. There was also a caution to note that PSAPs are time-consuming and should be used as a benchmark and must be actioned in order to be useful. The second one, order of priority, was to arrange timing of PSATs to key milestones. And here the team agreed that it would be great to align PSATs to activities like country midterm reviews of national plans, whether it be the national HIV plan or the sex worker plan and so forth, but also to align it with activities like the development of new plans. For example, Malawi was developing a condom plan and found the PSAT very useful for that. The third priority would be to expand peer-to-peer interaction. And here, although the team agreed that this would be really useful, we should consider COVID epidemics in each country and examine the regulations of entry and quarantine and so forth. However, we did agree that virtual interactions are useful and must continue. Fourthly, converting learning into action. The team felt that this probably has been done, converting our learnings into action, but what we need to focus on as a final step is on measuring the implementation and impact of converting learning on the ground. And then finally, as we were running out of time, we looked at mainstreaming action, and there was comments that the subnational level may be more complex to implement on, but that one could pilot elements of concern at subnational level. And that's it from team 3, and I invite the rest of the team members to contribute if I've inaccurately represented or left anything out.
Thank you, team 3, for that quick summary. We can give 1 minute to team 3 members to make any additions or clarification. And we can allow only 1 question for clarification in the interest of time. So group 3 members, if there is any addition you would want to make, the floor is yours. And the 1 minute is up. So if any group member who has listened to group 3 presentation would want to make an addition or to ask a question, we shall accept 1 question, 1 or 2. Kindly take this opportunity to agree with group 3 by asking a question. Okay, it looks like group 3 work. Your presentation has been clear and it's agreeable to all the other group members. We thank you for that good presentation and clear work. Thank you, James and the team. We can invite group 2 or group 1, whichever is ready.
Group 1 is ready.
Please.
Group 1 is ready. Okay, Thomas.
Thank you.
So yeah, so I moderated the session, and basically we were to just validate the findings. We had 2 recommendations: expand the prevention focus and expand peer-to-peer interaction. Thomas took notes and will make his presentation on behalf of the group. Over.
Okay, right. I Thank you, Shegun. To the first question was what resonated most for you out of the country results shared? And we had the group mentioned 3 key things that resonated most. The first one was that the fact that there is even a platform to share learning around key population programming was outstanding because there was no such platform for such learning. The second one that was shared was that the PSAT process was an eye-opener because it helped countries understand where the gaps are. And also the webinars stood out because the webinars helped each country see what other countries are doing and increase learning, peer-to-peer learning. Then there was also this issue that was discussed in the group that it will be important that when we are done with learning, every country should also think through how to sustain the learning and how to adapt learnings from another country to its own country's specific needs. I think this stood out from someone who was part of the data collection during the survey. The second question was how we can implement the recommendations that were given. And for recommendation 1, the group agreed that it's important that we expand prevention focus beyond the current themes and beyond the current vulnerable groups that we are looking at. We also need to expand peer-to-peer interaction so that instead of just looking at interactions within the zones, there should be interactions within the country, not just across the region. And then there was a question of what we thought was missing from the recommendations that were given and why we think so. One of the gaps that was missing was that practical examples from each country were missing. This was explained in this manner that, for instance, if Kenya wants to expand into AGYW programming as part of this South-South Learning Network, it's not just okay to share best practice. It's okay to share the challenges that were faced while that was happening and how Kenya surmounted such challenges. That way, it will be easier and better for countries to learn not just best practices, but also to share how we got to that best practice, because there are always challenges to address as we travel to best practice. And then finally, again, how can the above recommendations 1 and 2 be implemented? One, what was recommended was that with peer-to-peer interactions, countries should bring in more key population organizations to be part of planning and implementations. In other words, we should expand the champions to include more beneficiary populations so that their voice will be represented in the process. And that countries should apply the SSLN approach, especially the PSAT approach, to additional thematic areas, additional key populations, and whatever new countries we are expanding to. And then we have to expand to ensure that we complete the loop. We don't just start from PSATs and stop somewhere. We need to come back to the results of the PSATs and look for strategies to make sure, after identifying gaps and weaknesses, we're able to implement the recommendations as it were. And finally, it is important that sharing learning should include biomedical prevention, especially oral PrEP and emerging PrEP technologies, so that we don't just focus on condom, but we should focus on other biomedical prevention strategies. I think those were the notes I was able to take, and I will allow members of the group to add or remove. Thank you very much. Hello. Hello.
Okay, thank you, Thomas.
All right.
Thomas and your team group, team 1, for that very elaborate presentation. So it is as we are doing 1 minute for members of that group to make any additions or clarifications, what could have been forgotten, and 1 question for members of another group will be allowed to gauge whether their position represents our positions, the position of all the members in the other group. If there's any clarification.
Dr. Daniel, Thomas captured everything we discussed, and I think it's a true reflection of the discussion there. Over.
Thank you very much. Members from group 2 and 3, did you have any questions, any additions to what our comrades in group 1 have presented? It was very clear, it was very elaborate. And there is no hand up. I would want to invite the group 2 to share with us what they agreed upon in the breakaway session here.
Boa tarde mais uma vez. Dizer que para o grupo 2, o que foi feito foi a validação da apresentação daquilo que foram as implementações e a percepção daquilo que a pesquisa foi.
So, if I may ask, is everybody hearing English? Because it seems there is an interpreter here involved, and you may need to go to the bottom of your table, of your screen. You'll find an icon which looks like a circle. And if you click on it, it will bring options of languages, and you can click English. So we can proceed, Dr. Samuel.
Obrigada. Dizia eu que o grupo fez apenas validações em relação à apresentação feita pela doutora Lorana. Consideraram que os aspectos observados em relação aos desafios e às recomendações foi aquilo que observou nos seus países durante o inquérito. E dizer também que um dos aspectos que surgiam como aspectos para a implementação comportou-se na expansão da interação entre pares de forma presencial. Seria importante fazer essa interação de uma forma presencial. Quer dizer que não tivemos muitas contribuições em relação a... Ok. Alô? Alô? Consegue ouvir?
I can hear you, Dr. Samuel.
Hello.
Alô?
Okay.
E eu dizia que seguimos com as validações feitas sim, em relação à apresentação e dizer que o que ficou dito para o grupo foi que era importante fazer a expansão entre pares de forma presencial. Então, dizer que não houve muitas contribuições em relação à apresentação, porque alguns membros do grupo não puderam participar da apresentação, e dizer que foi mais ou menos isso que nós podemos tirar. Não houve muitos aspectos relevantes em relação à discussão em grupo, mas o que ficou foi em relação a expandir a interação entre pares de forma presencial. E muito obrigada. Talvez dizer aqui que o grupo pode ter mais oportunidades para dizer aquilo que são as considerações e observações em relação à implementação. Muito obrigada. É isso.
Thank you, Samuel, and the interpreter. And we thank you, South Running, for trying to mitigate the language barrier there. So, members of Group 2, if you could clarify, maybe add on to what Samuel has shared, or if there is any question from the other group members, we can take the next 2 minutes, and we can finalize this discussion, agreeing that the presentation from the various groups, even if we are not in all those groups, they reflect our feeling towards this exercise, towards the exercise. It's coming out clearly, and from my understanding, the South Running, the first months, the 18 months were for small scale But what comes out continuously that people are yearning to do more. Why didn't we do all the key population groups? Why did we do only condoms? Why don't you leave us to do all the pillars of prevention? And that clearly shows that we are ready for the next phase of the South-South running. I don't see any hand up willing to contribute to group 2. The presentation were clear. I'm very sure the rapporteur captured them well. I thank you for being a good audience. Back to you, Chair, to take on to the next session.
Yes, thank you, Daniel, and thanks to the participants for those excellent contributions. For the next session, we'll have Dr. Rogero Feli. I'm also told you can call him Dr. Roger, so I prefer to stay with Dr. Roger. Dr. Roger is the Executive Manager of the Technical Support Unit, Resource Mobilization and Donor Coordination, South African National AIDS Council. Dr. Roger, please chair us for this session on technical assistance and opportunities. Thank you.
Thank you, Dr. Kalada. Yes, you can call me Roger because I don't want people to bite their tongues trying to pronounce the other name. No, colleagues, I'm going to chair this session as indicated, which is a session on technical assistance opportunities. We've got 2 speakers. The first one, and I suggest that we take questions after they've both spoken. The first one is from Carl Schutter, who is a health economist working at Genesis Analytics. Genesis Analytics in South Africa. He co-manages the health economics unit in the health practice. Carl has over 20 years of experience in costing, budgeting, and economic analysis of health programs, transition readiness assessments, and sustainability investment cases. He has an interest in routinizing and building capacity for costing and cost analysis in countries. And I can say that for SANAC, he is providing such support in development of the country's sustainability system for donor funding. So I'm going to hand over then to Carl to take us through the Understanding HIV Costs and Sustainability, or UCAS. Over to you, Carl.
Thank you very much, Dr. Rogero. Good afternoon, everybody. I won't take much of your time today, but I just did want to create some awareness about some guidance that we've developed as part of the UCAS grant. Next slide, please. So just a bit of background. Genesis Analytics is implementing the Understanding HIV Costs and Sustainability grant, which is a Bill and Melinda Gates Foundation grant. And in some ways, like the South-South Learning Network, this is a learning grant. And one of its important outputs has been the guidance that we've developed for selecting appropriate methods and tools for HIV economic studies. And I just wanted to share this guidance with you, or create awareness around this guidance and how it might assist you. The guidance is aimed at policymakers, planners, and program managers and budget officials. And it has sort of 3 main objectives. And the first is to assist users to clarify their planning and decision-making information needs, as far as these relate to resource mapping, expenditure tracking, and costing. And by costing, I mean here costing, actual costing of health programs, but also projecting costs for implementing or scaling up health programs. Secondly, a key objective here is to help planners and users to choose the most appropriate costing approach and methodologies, and the tools that most closely link with those approaches and methodologies, given the identified information needs, and really trying to prevent a mismatch between what users really need and the actual studies that are actually deployed and implemented to make sure that the results that are ultimately produced match the information needs. And ultimately, the idea is to help in the production of better costing data or expenditure tracking data. And this data will then obviously inform COP and Global Fund guidance, but also other planning processes and country budgeting and so forth. Next slide, please. So what we decided to do is, in order to try and give structure to this sort of guidance, we adopted a generic planning and resource management cycle. And this cycle has 4 stages in it. And the first stage is the policy planning and prioritization stage, so quite high level and strategic level stage. The second stage is a more detailed stage of compiling budgets and allocating resources to specific health programs. Stage 3 is all about budget execution and routine monitoring of the budget and implementation. And the last stage is sort of a big bucket which provides for generating evidence and evaluation data, which in turn informs stage 1 again. And so very broadly, the way that the process or the way the guide works is it follows a logical process, and the first part of the process is about helping users to position themselves and their information needs on this planning cycle so that they have a clearer understanding of what their information needs are. And it does so by under each stage listing the typical research questions that one might ask in that stage. It lists the typical study types and the outputs that would come from those studies, again, grouped by stage. So the idea is that the user would position themselves in each one of these stages, and once you understand information needs, that the guide then logically links you to the various methodologies and tools that will help to meet those information needs. And in the annex to the guide, the actual guide's not that long, but in the annex to the guide, we have sort of 3-page descriptions of each one of the methodologies and tools for approximately 20 globally used tools. And one particularly useful feature of that annex is that within the annexes are hyperlinks to websites where tools can be downloaded, but also real-life use cases or independent reviews of those tools or detailed descriptions and user manuals. So it becomes very easy to move from the guide to more detailed information. And ultimately, you know, in addition to helping in the choice of appropriate methods and tools, the output from the guide will also help planners in the development of their requests for technical assistance. It is aimed to make sure that terms of reference are appropriately described, so that the work gets done according to the objective, and also to evaluate proposals. Next slide, please. So just to recap, basically the guide provides for a 4-step process, as I've just briefly mentioned, but just to unpack that a little bit. Step 1 is all about making sure that you are able to identify the real information need and its purpose and its use case in the context of the 4-stage planning cycle. Once that has been done, the idea, question, and type of economic investigation or study type. And once that is done, the guide presents the user with the most appropriate costing approach. And if the approach makes sense, given the selections in the first 2 steps, it then provides links to the tools that are most likely to meet that need and that have adopted that sort of costing approach. So it's a step-by-step process, and the guide actually works that way. You click your way through the guide rather than turning pages. It's an electronically presented guide and very easy to use. And I just wanted to share with you that we tested this approach and the guide in 2 countries through the South-South Learning Network. One was in Uganda, the other one was in Kenya. And colleagues on the call may have been part of this process, but we had a number of interesting discussions using the planning cycle as a guide to explore exactly what those information needs were. And I think it was quite interesting because from an initial sort of, we need costing data. The two discussions evolved into slightly different directions. And in the case of Kenya, we established that the real need was for advocating for resources, additional resources to implement KP programs in all the counties of Kenya. But the real need there was for a fairly high level resource need estimate, and there wasn't a need for a high degree of detail. And it was more important to establish a ballpark figure for resources required to implement KP programs. Whereas in Uganda, the costing need there was for a much more detailed costing of a KP action plan, which resulted in sort of the costing of activities using ingredients-based costing. So I think in both countries, it was really helpful to go through the process to make sure that the needs, the information needs became really crisp. And from that, it was possible then to choose the appropriate costing methodologies and tools. Next slide, please. And yeah, just a picture of the cover of the guide. It's a PDF guide. It should not be printed. It is presented electronically, and the entire process requires the user to simply click his or her way through a set of menus or the planning stage, and fairly easy to use. But of course, there are sections on how to use the guide and so forth. But so far, the feedback we've had is that this sort of approach, rather than submitting a document that has to be printed out, works extremely well and can easily be emailed and used. Last slide, please. So colleagues, the questions we have is how can we help you to articulate your health economics information needs? And we can do this in a number of ways through the South-South Learning Network. Initially we could have a briefing meeting with the country team members to share more information about the guide and how it actually works, and whether we can assess whether or not use of the guide would be valuable. Secondly, we could potentially support you to in fact use the guide and articulate your actual costing and budgeting needs based on findings from the PSATs, and help you to sort of crisp up your TA requirements. We could also assist with the development of terms of reference should you have used the guide yourself, or if we've guided you through the first two steps. And lastly, there are opportunities to assist with discrete costing and budgeting TA through South-South Learning Network. And just to say that if this is of interest to you, you can reach out to us either through your South-South Learning Network country champion, or you can email Alison Peterson on the address that I have provided you with. We will then reach out to you and have an initial meeting to see how we can best assist. Chair, that's all from my side. I promised to stick to my 10 minutes, but I don't know if we should just pause for a second because I actually have to drop off. So I was just wondering, contrary to your request, sir, I respectfully ask if we can take 1 or 2 questions now, and then that'll be the guide done and dusted.
Okay, no, thank you very much, Carl. I think this was clear, and given the fact that you've complied with the time, I'm sure we can take questions or issues of clarity. I'm sure that it's clear how you presented that the guide can be used, and it would have been good also to just get a couple of inputs from the users in Uganda and Kenya if we have time at the end. But over to you, colleagues. Are there any questions for Carl?
Chair, while we wait, I can just mention that it is in draft form. It's a document that keeps evolving, and the minute we get comments, we do update it. So just to say that, that I suppose there are different versions of it that are being produced.
Okay. No, thanks, Carl. I don't think there's any question, so it's quite clear.
Yeah, there's a question in the chat box. I asked 2 questions in the chat box, please.
Okay, can you go ahead? Sorry, I can't see from where I am.
Okay, the first one is I wanted to find out how useful variance analysis is in tracking budget implementation. Variance analysis in tracking budget implementation. The second thing is how they can support the country in determining costs, the costs clients reached. It's very challenging to determine the cost part. So if you say you reach a client with, say, condoms and lubricants, what goes into that? I don't know if there's a universal measure of that, or we have to take the country context into consideration. So that's the 2 questions I asked. Over.
Okay, over to you.
Thank you very much. Those are great questions, and I'll start with the second one. I mean, arriving at accurate unit costs is really topical and important in resource planning. And, you know, there are a number of different approaches, and to some extent, it depends on country systems and how they track expenditure and how they analyze that expenditure and how much detail it is available. And based on that, you know, one would choose a slightly different approach. But certainly this is work that is being done and is ongoing in many countries, useful for both government and partners because it clearly informs planning. So we can certainly provide that level of support. The first question, how useful is variance analysis in tracking budget implementation? Well, I think it can be very useful. My experience with variance analysis is that quite often the reasons given for the variance are a little superficial, and the real value in variance analysis, in my opinion, is to really dig deep and find out why that variance really occurred. And from that can come some extremely valuable findings and insights. And I find it particularly useful when one compares variances in different settings within the same country and different facilities to try and understand why those variances occur and to what extent volumes, for example, impact on unit costs and so forth. So I think it is valuable.
Okay, no, thanks very much, Carl. I'm sure that if there's further questions, you have provided the contact details. So colleagues, I suppose we need to move to the next speaker, who's going to take us through the UNAIDS technical support mechanism. The speaker is Dr. Anthony Kingon, who is a doctor, health economist, and public health practitioner who's based in Johannesburg. He's currently the technical director of the UNAIDS technical support mechanism. He has a keen interest in the role of an effective development process to ensure that countries and service users can influence the use of resources. So we will ask Anthony to take us through his presentation. Over to you, Anthony.
Good afternoon, colleagues. Good to be meeting you after hearing a lot about the work that you've been doing. As was mentioned, I'm going to introduce you to the technical support mechanism, which is UNAIDS facility that is essentially available on call to countries who may need technical support to implement programs in a number of areas. And essentially our focus is really to try and make sure that global fund grants work well. But obviously that often means that we need to support broader national program processes. So although we are asked to justify everything we do in terms of making sure that more people are served better by global fund grants, that doesn't really constrain us too much. Just to give you an idea about the USAID, although there is other funding from groups as diverse as Luxembourg, Germany and the Australian parts. Most of our work focuses on three main result areas. The first is that we are asked to empower countries to use the data that can be available to them and to help them to generate that data, to help them to accelerate the policy and program implementation in priority areas. And as with all of our work, we focus on key and vulnerable populations and really the groups and parts of the response that are left behind. So that is one of the key things that we try to do, to fill gaps and make sure that we're plugging gaps with you rather than adding to well-served areas. So after harnessing data, a lot of our work is with both governments and partners and community organizations to work on practical aspects of accelerating their implementation of programs. And so this moves more from the kind of situation analysis stage into the implementation support stage, and closing gaps in coverage and impact. So as you can imagine, quite a lot of our work over the last while has been looking at innovative models to make sure that our programs keep going and actually increase their impact despite the challenges of COVID. So a lot of it's been focused on differentiated service delivery and improving the information that allows us to service populations well. And then the third main focus area is to start working with countries to, first of all, improve the efficiency of our programs. So it's really saying where we're effective, how can we actually increase our reach with a similar resource envelope to make sure that we can service the increasing numbers of people and the harder to reach people within our countries. And in addition to increasing reach, which a lot of the work looks at the economics and the practicalities of sustainability and how to make sure that we can use domestic resources as a stable base for country responses in the longer term. And again, we focus on community-led responses. So how do we work with particularly innovative civil society organizations and ones that deal with the barriers to both prevention and treatment, which are raised by human rights and other challenges. So within those three broad areas, we have a number of areas that we call thematic areas, and overarching them is a group who focus on the global fund specific issues around applications and also implementation and adherence to global fund requirements to make sure that the grants are implemented well by countries. And so we provide support there. And again, we focus, in addition to the global fund specific aspects, on firstly strategic information, that harnessing data. And this overlaps with prevention agendas in many ways. For example, we've been involved in supporting a number of integrated biobehavioral surveys, which look at the specific needs of key populations and vulnerable populations. So that generating that kind of information, we also do reviews of programs to provide the kind of programmatic information that allows people to map gaps and identify opportunities for strengthening things. The second focus area is community-led interventions and community-led monitoring, which have become much more a focus of many programs worldwide, particularly during COVID, as more sustainable models for interventions. So there are a lot of opportunities as well as challenges there. Then we do have a specific focus area on prevention, which covers the full range of prevention technical support. So examples of what we've worked on are developing guidelines, evaluating pilots for PrEP in various parts of the world, looking at broader prevention needs and initiatives. So full range there, although to a significant extent, because our UNAIDS colleagues are a solid part of the prevention coalition, in many of the prevention needs are serviced by the coalition rather than the TSM as a standalone service provider. And as I mentioned, we focus a lot on issues around human rights and gender and stigma and discrimination and the barriers that can be raised by those to prevention. And similarly, we look at both the technical aspects of testing and treatment, also integrating services like PrEP and mother-to-child transmission into routine services. And then we do quite a lot of work on the economics of financing and sustainability of macro programs as well as specific interventions. And then a final area that we do quite a lot of work on is strategic and operational planning. And that can range from national strategic and operational plans right down to organizational plans and strategies for civil society partners or national aids authorities that are looking at streamlining their approach over the next few years. And so whether we're talking about global fund grant applications or strategic and operational planning, we are very often providing technical support over a range of areas that will include prevention. And so we're quite often called on to bring in specific prevention expertise as part of those broader areas. Could we move on to the next slide, please? Okay, this slide just gives you an idea about the different UNAIDS regions that we support. So this just looks at 5 months of this year, and you'll see that most of our work, or the majority of our new assignments, and this is just new assignments, were in Eastern and Southern Africa, and then the next hotspot was West Central Africa, followed by Asia Pacific, and those are 3 main areas of function. So Asia Pacific includes South Asia, countries like Pakistan and India. And so we have potentially useful linkages with people who are working on key population programs and potentially people who can be involved in learning networks and sharing of learning across quite diverse epidemics. So harm reduction is, for example, one of the areas that we've done quite a lot of work on, not only in Asia Pacific, but also Eastern Europe and Central Asia. And then we do some work in Latin America and the Caribbean, which again also sometimes gives us interesting resources and experience that we can potentially share across the regions. Okay, can we move on to the next slide, please? Maybe just to say that over the last couple of years, we've done over 400 assignments globally. So we get about 10 new assignments a month. So there's quite a high volume. And we have a prevention lead who is well interfaced with the Prevention Coalition's work. So hopefully we coordinate our thinking across that. And then we have other technical experts in other areas who can help with technical aspects. Just to give you an idea about the process that you might face either as a country or an organization that's looking for technical support, we try and make sure that the technical support is well planned and that you supported to get the maximum mileage out of any technical support that comes in. So essentially what happens is that the first stage is that countries would, or organizations would liaise with their UNAIDS country offices and try and ideally building well ahead of time the technical support needs into what we call a virtual technical support plan for the 6 to 12 months ahead. Although we like generally to try and encourage people to plan well ahead, we do recognize sometimes it's unavoidable that you have urgent technical support needs. So there are ways of approaching your country office to get technical support, even if it is an urgent emergency thing. Then beyond the kind of in principle planning of the technical support, which we try to make sure fits not only with the country's strategic priorities, but also our program mandate, then there's a stage of technical support design. So this is working on developing terms of reference, consulting with stakeholders so that you know that you've got a robust plan for this specific assignment. Then there's an element of technical review and quality assurance, which involves both regional teams and Geneva. And then once that has been worked through involving country partners and UNAIDS colleagues, we as a TSM help to identify quality consultants and put together teams, and we'll speak a little bit more about teams and consultants in a moment. And then we provide backup support during implementation, and then quality assurance of the final products and feeding into the learning that the South-South network could do, and hopefully with quality information that'll help you. So we tried to make sure as the UNAIDS overall team that we support you through technical support and maximize the impact and effectiveness of what you need done. Can I move on to the next slide, please? Okay, this just is really a slide to signal that what we've been trying to do increasingly over the years is make sure that we focus more and more on using national, and so you'll see over time the majority of our consultants that we've contracted over the period, so this is over 800 consultants, have come from the 3 regions that we serve, so Asia Pacific, West Central, and Eastern and Southern Africa. What we've also seen in the last period with COVID is that we're relying more and more on national consultants and really developing a new model for providing technical support where we use our national consultants more effectively, provide backup and support and kind of professional development and enrichment if necessary from international sources. But we are focusing more and more on local. And another thing that we're looking at is continuously is trying to use various civil society and other organizations to provide technical support so that we build their capacity and them as a resource to the countries that we work in. Okay, you might have questions about that. I think we're moving to the final slide. Okay, yeah, rather than anticipating all your questions, I'm going to invite you to ask questions and clarifications. So I just wanted to let you know how to access the technical support mechanism. And there may be two sets of interest that you have. If you as an organization or as a country team need technical support, the main entry point is through your UNAIDS country office. So you may have prevention technical advisors, or you might know the UNAIDS country. And so you can approach your UNAIDS colleagues, and they basically feed your request into the system, and their approval and ability to kind of certify that it is a country priority is really, really important. They are your main entry point. Some of you might be involved in inter-country or regional initiatives, and in those cases, you're encouraged to contact the UNAIDS regional support teams. So there are support teams in Eastern and Southern Africa with contact around particular needs that cross countries. Some of you may also be interested yourselves or in referring other people as potential consultants or referring organizations who might become providers of technical support. And so we'd encourage you to please contact colleagues in the OPM team and the Genesis Analytics team to register your CVs and organizations. And then what we do is we do a kind of pre-screening. We get an idea of the expertise and the track record, and then we try and make sure that even for organizations and individuals that aren't particularly confident as consultants, we can use them as part of teams to build your confidence and ability to service your own country and region as soon as possible. So if you're interested in technical support in either of those areas, please firstly see your UNAIDS country office as your main entry point for actually getting technical support, and then please contact us as the OPM, Oxford Policy Management, or Genesis Analytics teams to make sure that that you or people that you know who are good get on the database. Okay, I'll stop now and invite questions from you. I tried to make sure that I said less rather than more, but I'd be happy to fill in the many gaps that I've left.
Yeah, no, thanks, Anthony. I don't think we have enough time for question. I already see the suggestion from Kerry that if there's any questions, if the colleagues can rather type it, because I think you have indicated the exact TA that you are able to provide, as well as the, you've explained the entry points through the UNAIDS country offices, as well as the regional structures. So if you will allow me, I will ask colleagues perhaps then to put the questions on the chat box so that you can get back to them. So thank you very much.
Maybe if we could go just to the next slide, then if anyone does want to contact me directly, there's my email address, anthony.kinghorn@gmail.com. So please feel free to contact me if you have questions too.
Yeah.
Okay. Thank you very much, colleagues.
No, thanks. Can I hand over back to you then, Dr. Kalada?
Yeah, thank you very much, Roger. And in the interest of time, I'll quickly call on Ellen Mubanga, the Public-Private Sector Coordinator at National HIV/AIDS STI and TB Council for Zambia, to take us through this storytelling narrative session as chair. Thank you.
Thank you. Good afternoon. Are you able to hear me?
Yes, please.
Yes, we're hearing you clearly.
Thank you. So indeed, I'd like to welcome you to this session, I believe, which is the last session that we are going to have. This session is basically going to give us a synopsis or showcasing of the great innovations that countries have and also will implement alongside the support of the South-to-South Learning Network. So at this moment, we invite Mohammed Khan to take us through as our presenter for this session. Thank you. Mohammed, over to you.
Thank you, Ellen, for that lovely introduction. So if we could move to the next slide. Just two up. I think one of the things that resonated throughout this meeting is that practicality, peer-driven activities, participation, and the opportunity to share and learn good practices have been a common theme. This presentation in particular will cover virtual study tours, case studies, as well as our recent support of virtual mentoring. As you can see from the slide in front of you, we have virtual tours, and these are envisioned to be short recordings of approximately 15 to 20 minutes and aim to capture the experience of a country visit. It encompasses introducing and showcasing good country prevention practice, providing an opportunity for countries to share their learnings and progress to peers. These tours provide a voice to national prevention leads, program implementers on the ground, as well as civil society networks. These films are planned to have a live viewing by all 10 SSLN countries, and participants are invited to be part of the Q&A session to speak more on their experiences. Paranita has already provided an update for the countries participating in the virtual tours, so I will not belabor that point, but acknowledge the contributions of Kenya, Malawi, and South Africa, with sharing their interesting topics with us, such as safe spaces for KPs, as well as programming for young key populations. SSLN is able to provide robust support, as we believe that there are great practices that can be shared visually. And I want to invite us on the next slide to have a look at a small teaser trailer from our filming of the South African virtual tour. and say thank you to the South African team for participating, allowing us to support them in capturing all of this. I hope that this shows how interesting this type of talk could potentially be in your own country context. Moving on, I wanted to talk about case studies. So these are the tried and tested approach for knowledge dissemination. However, the SSLN encourages case studies that are practical and speak to HIV prevention peers' needs. So they aim to provide lessons to be learned and applied from others in similar contexts. We aim to support countries to develop and document prevention practices that they have identified. And we call on a utilization-focused approach when we work on these case studies, as they speak to being usable in a practical manner. A consideration for all that have participated in a Link and Learn session is that these topics can be transformed into a case study. So I would like to invite all members to consider and reflect on which good practices they have and reach out to us, and we will be happy to support in a very robust manner, which will be covered in the slides ahead. Perhaps we can move on to the next slide. So some countries have engaged in virtual mentoring to cross-share on topics relevant to their country context. This has come about such as in microplanning. And this follows from a joint Sequin and SSLN session that touched on microplanning for key populations by Kenya. The Uganda team reached out via the SSLN to the Kenya team, and this interaction expanded into a set of mentoring sessions, with Kenya being the mentor. These sessions are approximately 2 hours long and are held every second week with a set agenda and objectives clearly outlined. There's key speakers and there is a clear outcome that is aimed for each session. These sessions are currently ongoing and virtuality remains the norm, but COVID permitting, the virtual mentoring may be solidified by an in-person site visit in Kenya, hopefully at a later stage. So I would ask that we move to the next slide. Essentially, if you would like us to support on any of the topics that I've talked about above, if it is on a virtual tour, simply speak to your country champion and SSLN will support the country in building a storyboard as well as paying for the filming. If you have good practice that can be written up, reach out to your country champion and SSLN will support on drafting, verifying information, holding key informant interviews, as well as final presentation formatting. And if you feel that you could benefit from mentoring, reach out and let us know if you're keen to be a mentor with a strong prevention practice that you can share, or if you'd like to be a mentee and have identified an area that needs strengthening. Perhaps you've identified a topic from one of our previous Link and Learn sessions or something that's coming up. To end my presentation, I welcome you all to keep in mind how you can share practical, peer-driven activities and identify areas for good learning practices to be shared. Thank you.
Thank you for the wonderful presentation. Indeed, great innovations that have been showcased. I'll now invite questions from our participants. Any questions that you can bring forth? Any questions? I can't see any hands in the chat. There are no questions. Any questions?
Sorry.
Please go ahead. Yes.
This is Josefa from, aqui é Josefa de Moçambique. Eu coloquei uma questão, mas a questão é para a apresentadora anterior e coloquei aqui no chat box. Eu não sei se poderão responder, se já estou ultrapassada. É que no momento em que eu ia tentar levantar a mão, já estavam a passar a próxima apresentação. Então era só para ter atenção à questão que está no chat box para que nos possam responder. Obrigada.
Thank you. I wasn't able to get the interpretation for English, but I believe there was a question asked and somebody responded in the chat towards what Josefa has just articulated. Any other questions? And the response...
Mas posso, ou o intérprete pode traduzir, ou eu posso repetir em inglês meio broken, mas posso tentar.
Okay. Thank you.
Hi, Ellen. Ellen, it's Kiri here.
Yes, please go ahead.
Desculpa, não percebi.
Ellen, we were able to translate Josefa's question in the chat box. I think she was hoping that some of the previous speaker ants might be able to engage. I wonder if someone in relation to the MAP program in Uganda might also have a view to share. So maybe I can suggest that I can link Josefa up with both of them, and we can try and respond to her question.
Thank you, Carrie. Thank you very much for that. Yes, I've read through that it was translated. And so I think it is clear. You can go ahead and link her to the presenter of the last session. Any other question or contribution to the presentation that has been made on innovations in Uganda, in South Africa, those innovations that have been shared with us? Any questions? If there are no questions, I will hand over the chair to our chair for the day. Thank you very much. Thank you, Muhammad, for the wonderful presentation. Thank you.
Thanks, Ellen. Thanks very much. In the interest of time, I'll quickly call our speakers who will be making our closing remarks. And the first will be Jane Okra. Jane Okra is a community support advisor on UNAIDS in Ghana. And the second whom we want to welcome specially. So let's do a special welcome to Paula Auberson-Munderi, the Director of HIV Prevention in UNAIDS, and also coordinator of the Global Prevention Coalition at UNAIDS. So we'll have our two speakers. Jane, over to you, and then Paula.
So thank you very much, Dr. Kalada. Thank you all, colleagues, country champions, facilitators, and the SSLN team. I want to thank you for this afternoon. You all agree that we've really had a great experience. We've learned the importance of coming together. We've learned capacity building. We've shared experiences across continents. And you agree that the presentations we've all had, from the country progress to the successes, to the recommendations, the group work that we did, to the innovations that was just presented, and then the technical assistance on resources and opportunities, they've all been very, very wonderful. And we've really learned a lot from it. What I just want to say to all of us is that as we move forward to the next stage, I want to encourage all of us to keep the focus. We know that we are working towards the Global 2025 prevention targets. So we need to focus on these targets. We need to push ahead with our learning and action agendas. That's where most of us are now, to ensure that they are well integrated into our national agendas, to ensure the right ownership and sustainability. And for the SSLN team, want to encourage, we know you've done a lot, actually saw through this program and brought all of us this far. We want to encourage you to consider all the recommendations that we've made, and especially the technical assistance that we need to strengthen the work. Once again, I say a big thank you to all of you, and I wish you a very good day. In Ghana, we say, Medamasi.
Thank you very much, Jane. Paula, over to you. Yes.
Thank you, Dr. Kalada. Good afternoon or good morning,
colleagues, friends. We've been, or at least I have been in and out of the meeting, but I'm really very, very pleased and honored to have been to be a part of this. It's quite clear from this afternoon that since the last champions meeting in February, the participant country engagement within the South-to-South Learning Network has intensified, and on both sides there has been learning. So there has been learning between and within countries, between countries, but there has also been learning from the South-to-South Learning Network team, in that we have learned a lot from you as the participating countries. Principally, we've learned how to adapt and become more responsive to the needs as you all seek to optimize your prevention programs. I am aware, I'll be the first to admit, that we are aware that capacities and resources continue to be inadequate, and that especially the COVID-19 pandemic continues to affect our HIV prevention responses, which is all the more reason why we must continue to reflect together and to learn from each other and to share promising practices and adaptations. At the GPC Secretariat, we have initiated the process of developing a global HIV prevention 2025 roadmap. And this process critically requires us to take part in reflections such as we've had this afternoon on our collective experience, and it will indeed benefit from the awareness and the insights out of real-world program contexts on the needs of HIV prevention in the immediate and midterm future. And only then could we hope to achieve the bold new targets for 2025. So I really want to thank you, country champions, for taking up this role. We really did not know when we started close to 2 years ago where this would take us. So you were brave enough to take on the role of influencers of change, and you truly are leaders of prevention. And just as you're doing, good examples of prevention programs need replication. And for members and participants and other countries who are not yet participating in this to be able to tap into a network of peers provides a source of knowledge for action, which is what we're looking for. And this is what we seek to support through the South-to-South Learning Network. And this is why we are proud to be collaborating on this initiative. So looking ahead to the next phase, thank you once again for being a part of this and for staying until the end this afternoon. It's been a long session, but a very enjoyable session. So thank you very much. Back to you, the organizers.
Thank you very much, Paula and Jane. I think at this stage, I'll just acknowledge our speakers, our various chairs, our interpreters, you, the participants, and of course, Jane and Paula for their closing remarks. And also I will leave out Kerry and the kitchen cabinet of SSLN, and especially Karabo, Gianni, and more especially Maria Mensa for putting all this together. Thank you very much and enjoy the rest of your day. Thank you.
Bye, everybody. Bye.
Bye-bye.
Thank you. Bye.
Bye, everybody.
Bye-bye. Thank you.
Bye-bye, yeah.